So we have talked about saving doctors' time. Now let's talk about saving lives because the real issue isn't just inefficiency. For millions, it is inaccessibility. Think about it. Over 70% of the Indian live in rural areas, but most qualified doctors, they're in the cities. In remote districts, seeing a trained doctor isn't just rare, it's nearly impossible. So millions rely on informal or unqualified providers, not by choice, but because there is no one else. And that's how people die. Not because their illness was untreatable, but because the right person wasn't there to catch it in time. And this is where AI can step in, not to replace doctors, of course, but to reach where they can't, to step in where no one else can. In India, the challenges are very different: poor connectivity, cost barriers, cultural stigma. And that's where Qure.ai comes in. They built an AI that reads chest x rays and flags potential tuberculosis cases. It is live 250 plus sites. This year, it screened over 1.7 million people. At the Kumbh Mela 2025, which is world's biggest religious gathering, Qure screened every chest x-ray in real time, even offline. Out of those scans, over a third were flagged as abnormal, and 12% showed presumptive tuberculosis. So, in a country still losing over 400,000 people in a year to TB is impact. Now, let's talk about breast cancer, the leading cause of cancer death in women worldwide. Here's the thing: it is treatable if caught early. So, what's the real challenge? It is not just medical, it is also about access, it is fear, it is social barrier, and that is where Niramai comes in. They built a no touch, no radiation thermal imaging tool. Women can be screened privately with dignity, even at home. It's already reached over 250,000 women, not in shiny hospitals, but in the very communities that often gets ignored. Her mission? To give every woman the power to detect disease early, without fear, without stigma, or cost standing in the way.